Have you ever thought of how it would be to live a life where you're free, fearless, and unstoppable? Imagine waking up in the morning, looking forward to the day ahead, enjoying a joyful, passionate life that you deserve. If so, our brand new Unstoppable, Renew You, Love Your Life 90-Day Coaching Program is for you. This is a balanced, well-crafted program that will guide you through a 3-step process over a course of 90 days that meets weekly, led by Dr. Stem over Zoom. In 12 weeks, you'll get to the heart of what's holding you back so you can reset and refresh your life. The program is based on 3 pillars: inner healing, self-discovery, and self-development. Don't waste any more time putting off your heart's desires. If you want clarity and guidance as you step into your wholeness, join Dr. Stem in this life-changing program. To be a part of the next group, apply at www.drstemy.com. Seats are limited. Go ahead and register. Now, here is Dr. Stem.
We are going to talk today about maintaining balance and also maintaining your mental health. Pardon me, excuse me, I have so much information. I just wanted to make sure that I can share with you. So I might be going a little bit faster than normal because I want to leave a few minutes at the end of this year so that you can ask questions. But just in case you don't have time to ask questions, I'll have my email at the end of this presentation. Please email me and let me know that I am a member of New Horizon. I had a question about what you said about such and such, and I'll certainly take the time to respond to all of you. So for you to get the full, aspect of this presentation, I'm going to go ahead and turn my camera off so that we can see the full slide PowerPoints. And again, write any questions that you might have in the chat room. I'll check in the chat room at the end. Or if not, please somebody take note of all the questions, email me, and I will respond to you accordingly. Let's begin this wonderful training, which I'm very excited to bring to you today, maintaining balanced mental health. So because I did say that I'm a mental health professional, I have to say this, that this presentation is not intended to provide medical or mental health advice, diagnosis, or treatment. It is for your educational information only. Because as you know, once you know better, you can do better. And when you understand what to do and how to do it, you are bound to take action and take care of yourself. So, okay. We have a stigma that goes on with mental health when we're talking about mental health. And, I'm not quite sure where everybody's background is, but, just in case you're from Zimbabwe, like I am, right? Mental health was something that was taboo, in Shona, we say kupenga, mental health was, related to people that were, in other words, described as crazy. They were not functional. So we didn't understand mental health to be what it really is, that it's not just about being crazy. And what you will see in this presentation is I will be discussing and talking about, what really mental health is. And as you can see in this image, right, it's everything from stress, trauma, bereavement, grief, dementia, anxiety, depression. It's everything, not just what we've believed it to be. A shift in mindset is required if we are going to be talking about mental health and really embracing making changes in our life. Brene Brown is a fellow psychotherapist like myself, and I love this quote where she says, everyone has a story that will break your heart. And if you're really paying attention, most people have a story that will bring you to your knees. We all have a story. So why is it important for us to eliminate the stigma? The stigma is that it closes us out from really taking care of ourselves. It closes us out from really understanding each other, embracing each other, because with the stigma, it brings negative attitudes, right, on mental health. You cannot, it's easy for you to say to people, I have a headache and I couldn't, even focus on coming to work today. So, I'm not feeling well. So can I call in sick, right? But if somebody calls in sick and says, you know what, I just feel depressed today and I'm just anxious, everybody's eyebrows will be raised like, what? So that means, the person is depressed. Ooh, did you hear that person? We start talking about it and we start talking about people. So what happens is there's a big impact that happens if we do not get to let down the stigma on mental health and normalize mental health as something that everyone struggles with. So the impact or the stigma on mental health well-being, becomes that people are reluctant, as I say, to talk about what they are feeling. They are reluctant to seek help or to seek treatment. There's also social rejection that happens, and also people start to avoid you, or you start to avoid other people and isolate yourself when you're feeling in the dumps or feeling like not yourself, which is, a part of mental health as well. It also becomes worse because then, without that treatment, without being able to talk about it freely, it really brings it, in a place where people are more isolated and actually become even more depressed. There's a lot of harassment for people that have mental illness, especially when it's mental illness, which is a more severe part of mental health. And I'll talk a little bit about it, in the later slide. But what happens is there's a lessened quality of life. People are not able to live their best lives when they are, dealing with mental health problems or mental illnesses, and especially if they're too shy, too embarrassed, and to seek help and to seek treatment that might help them. There's also an increased feelings of shame and self-doubt. And you'll notice that, other people will start dealing with the mental health or mental illness in ways that are not acceptable, or that actually even damage them or hurt them even more, because they are not able to open up that they're struggling with mental health. And we'll talk more about some of those things that people, do. So here's the key thing about this training. If you don't remember anything else, please remember that mental health does not discriminate. It doesn't matter whether you're black, white, yellow, green, old, young, or anything. It affects all of us. Mental health issues can affect anyone regardless of age, gender, income status, religion, spirituality, sexuality, or even cultural identity. I wish somebody had told me this when I was in Zimbabwe, because I didn't understand it, didn't know it. And now it makes sense on a lot of things that I grew up seeing from our parents and grandparents, and everybody struggling with mental health, but nobody knew what it was. Defining mental health and emotional well-being today. So in an effort for us to even, talk about the mental health without thinking about the stigma, right? I want to address it as mental health well-being, so that at least it eases up, because when we combine the mental health with the well-being, it becomes easier to understand that, whoa, this is really important if I'm going to feel better, if I'm going to live a happy life, if I'm going to even, wake up and do the things that I love doing and take care of the people that I love taking care of without judgment, but feeling like I'm fully myself. It's really important, especially in the work that you all do and the work that I do as a therapist and a coach, right? Because people can feel your energy. People can literally from afar know, what you're dealing with without even saying it to you, because they feel your energy. They can sense that there's something not right with you. If any of you are parents in this instance as well, where we are now, I want you to pay attention to the children, especially young children, teenagers. They will always start to act out. They will always start to show us something that will show you that, okay, even I need to check myself and put myself into check, because something must be coming out of my energy and, that I'm bringing out in this, environment, or in my home, or even at work. Now, before we go on, let's address this elephant in the room about the mental health effects from COVID-19. Let me tell you, there have been studies that says approximately 400 million COVID-19 cases worldwide, have been, detected, with over 5.7 million deaths of people dying during these last 2 years that we've been going through COVID-19. So what has happened is, for us that are still here, there has been a need to develop new habits and new ways of coping, because it's been difficult to even read or see the news or lose loved ones. I don't know any one person that has not lost a loved one, a relative, or somebody that they know who has lost someone that is a loved one in their family. I don't know one person. So because of that, there has been an increased, level of anxiety and depression in many people that have never noticed that, there is anxiety and depression that can come, from situations like COVID-19 effects that are there. So a lot of people are feeling fatigued. A lot of people are feeling, exhausted, like easily exhausted, and not knowing, I can't think straight. And sometimes I'm trying to wake up and I just can't feel like I have energy, because, we still have to face COVID-19, which is still here. And there are many, many of us that are still dealing with it on a day-to-day basis, as aftermaths of having dealt with COVID-19. So that's the elephant in the room when it comes to mental health effects. All of us have been affected with COVID-19 mentally and physically. So what is mental health? The World Health Organization describes it as a state of well-being by which an individual realizes their own abilities to cope with the normal stresses of life productively and fruitfully. I also like the description by the Centers of Disease Control and Prevention, which says our emotional, psychological, and social well-being is what mental health is. It also affects how we think, feel, and act. And mental health determines how we handle stress and relate to others and make choices. I like the one for the Centers of Disease Control. However, if you go on Google, you will find billions of descriptions of what is mental health. But for the sake of this training, I wanted to take these two because they are as close to what is as easy an explanation that I can bring to you as possible. But if you can remember that mental health affects the way that we think, feel, and act in every situation that happens in life, and boy, do we go through a lot of situations in life. Mental health in itself is important. It's something that everyone, again, experiences, right? It's linked to our physical health, but for some reason, we pay more attention to physical health and forget that many of the physical ailments that we go through are probably precipitated or started by a mental health, effect that we might be going through. So it's worth making time from your mental health and taking care of yourself. Because then what happens is when you do, it actually reduces also the physical ailments that you might go through. Mental health is not a sign of weakness. It's nothing to be ashamed of. It's not losing your mind and going crazy like we've been told, that mental health is. It's something that you and I all feel when we go through life's challenges and life's changes. We either feel hurt, we feel pain, we feel stressed out, we feel annoyed, we feel angry, we feel happy. All of that is mental health. So the struggle with mental health is that, many of us are not even aware of how frequent, people are diagnosed with a mental health ailment. And the problem with the numbers that we have, especially, for us in the mental health field, is many people do not go to get checked or even, assessed. So we have this small number, which is still scary, that we have 1 in 5 adults, especially here in the US, 46.6 million people who experience mental illness in a given year. But this is not even counting those that have never gone to, therapy or even get assessed or diagnosed. It also says, in the research, 1 in 5 people, right, youth aged 13 through 18, they experience severe mental disorders at some point during their lifetime. So, which is 13% for children aged 8 through 15. You might be wondering, okay, so what's the difference between mental health and mental illness? Don't worry, I do have a preparation, for us. So here's the thing. In the chat room, if you have access to the chat room, can I just get a Y or a no, or an N? I just want to make sure, is this making sense so far to just understand the importance of mental health on our lives? If you can just put in the chat room a Y or an N, just so I can see, one, that you are hearing me, two, that it's making sense, I would, really appreciate it, because I like to engage people. So I know time is, thank you, ladies. Time is of essence. And, I want to make sure that I also respect and honor that time that you all are here with me this afternoon. So what is mental illness? Remember, we talked about mental health. Mental illness is actually a severe part, of a mental health. So the APA, American Psychiatric Association, says health conditions involving changes in our emotion, thinking, or behavior, or even a combination of this is mental illness. Mental illnesses are associated with distress and or problems functioning in social, in our jobs, or even in family activities. Another explanation of what is mental illness is by the Centers for Disease Control, which says conditions that affect a person's thinking, feeling, mood, or behavior, such as depression, anxiety, bipolar disorder, schizophrenia. Such conditions are long-lasting and chronic and affect someone's ability to relate to others and function each day. So as you can see, when it comes to mental illness, it's a more severe diagnosis and more severe, ailment, which, again, needs to be prescribed or diagnosed by a professional. So I beg you to please not self-diagnose or even diagnose a friend or a relative or even a colleague, because there are certain aspects that we take a look at a whole, person perspective before we can even come up with, a diagnosis like depression, anxiety, or even bipolar disorder or schizophrenia. So what's the difference? Overall mental health, right? It affects our state of mind and wellness. Remember, it affects how we think, how we regulate our feelings, and how we behave. Many a time, this is like short term, that we can get over it in a shorter period of time. Whereas with mental illness, it becomes a condition that disrupts our state of mind and how we feel and behave, but it's a longer period of time. And the symptoms that go in with mental illness are even more severe, that they impact our lives, that we're not able to function on a day-to-day basis the same way that we can function with a general mental health. If, it gets to be severe, we seek treatment and we'll be able to function well and, as close to normal as possible. So what are the common signs of mental illness? Diagnosing a mental illness is not a straightforward science, like I said, right? So we can't test for it the same way that we can test for blood sugar levels or diabetes. However, if you are suspecting that based on what I'm talking about today, that you or a loved one might be struggling with a mental illness, just, give a call to a professional psychiatrist, psychologist, a therapist, and, talk to them. They'll be able to do a full diagnosis with you. So when you're feeling sad or withdrawn for more than 2 weeks, it's a warning sign that maybe you might be, needing that professional help to determine whether it's a mental illness, mental health problem that now needs more intervention than what you can do yourself. If you're struggling with trying to harm yourself or end your life, or making plans to do so, wanting to kill yourself or having a plan to do so, or even hearing someone that is, having a plan or talking about, harming themselves, killing themselves, that's a warning sign. Being severely out of control and taking risk behaviors that can cause harm, over drinking, doing drugs, and, just doing things that just shows that one doesn't care about their life, that could be a warning sign as well. Some people will have a significant weight loss, right? Or a sudden overwhelming fear of just being afraid for no reason, and being anxious where the heart will be racing, physical discomfort, difficult breathing, even sometimes if difficult eating or sleeping. Don't just go through those things without seeking, help or just assistance on how to deal with those. And don't be afraid that, if I go in with any of these symptoms, then they're going to put me on medications, and I don't want to take medications. There's so many other ways that, can be shared with you, of ways that you can take out of yourself. My thing when I do these trainings, if I'm speaking and I'm a speaker or doing a workshop, is to help people understand that you do not have to struggle and suffer alone. Talk to someone, and you get to choose the best way of taking care of yourself, but do not get to the point where you feel alone and you feel like nobody understands or nobody cares, when, in instance, you haven't reached out for help. We are in this country where, there are more services than where we come from. Let us not shy away from using those services, because it's about you feeling better and living what I term to be your best life. The signs and symptoms of mental health difficulties, are probably similar to the ones that I just previously said in there, where you're not enjoying what you want, to do on a daily basis. You can't get up to work. You're not eating well. You're not sleeping well. You're feeling irritable and annoyed all the time, and you just can't get yourself to really feel good. You get to drink a little bit too much, like I said, or do drugs, or just feel sad and down all the time. And it's now like 2 weeks, a month, 6 months, and you're just still feeling down, worried, stressed out. If that's the case, please seek out help, and just start off with just regular counseling. And then, from that point, you can talk, to your therapist, and they'll be able to help you, figure out what the next level of care can be. Challenges that contribute to mental health, again, as I said, COVID-19 is something that is affecting us mentally. So don't take it lightly, because some people have really, changed after having, contracted COVID. It's been something that they're continuing to deal with without knowing that, my feeling tired and exhausted is related to that. My being sick is related to, to that. So, what that does is it triggers what we call previous or past experiences that you have dealt with in your life, and maybe, thought, okay, I'm done with that. And yet it's something that comes back up again. The memories come back up again, feelings come back up, back up again. So it's important for you to be able to talk to someone about, what you're feeling. Real quick, the 7 components of good mental health is in-person therapy. Find a therapist or a person that you can talk to. If you have health insurance, I'm not quite sure if you have what we call employee assistance program in your organization, which many places they do. If you have it, it's called EAP, Employee Assistance Program. It gives you free sessions to talk to, someone in person. If you don't have it, your insurance will cover for mental health as well. So you can call the 800 number at the back of your card and ask them for therapist names that you can talk to. Community, you have this community and this family that you have at New Horizon. This is a community that you can also utilize, and you guys familiarize yourselves where in this check-in that you all are doing, which is awesome, you also can add in on there that I really have been happy this week. I haven't felt sad, or even, felt like, I couldn't sleep, eat, or anything. I feel good, or feel comfortable saying, I don't know. I just had moments where I just felt down this week, and I wasn't just feeling like myself, this week. So I think I just had little depressive moments where I was just depressed and felt anxious. And then I got to pick back up again, and feel comfortable, normalize it. Physical health, make sure you do get your physical health and, assessment every year. As you do that physical health, also call a therapist and just say, you know what, I just want to do a mental health check and, for my annual mental health check. And the therapist will be like, what is that? Because if they're not me, let them know to say, I just want to know whether, there's anything that I need to work on so that I can continue being able to manage my stress and being able to be happy and not worry in my life. And that's a good reason to just see a therapist and talk about what is going on. I'll tell you my experience. Every time that somebody calls in, they say, I don't even know what to talk about, but you know what? I just thought, let me talk to a therapist. Before we end, they will be going, wait. Is it time already? Can I just tell you one more thing? I'm like, no, you said you didn't have anything to talk about. But, obviously, I'll make another appointment if we're out of time at that time. Intellectual health, continue to feed yourself and, which I love that you all are reading the books, read more books, take more classes, attend more workshops and seminars, and just continue to improve on your intellectual health. Environmental health, be aware of the people that you're hanging around with. I know we grew up in an environment where in Africa, our family is family, and you get to hang around with family, and we are told that, family is family and we need to all stick together. But sometimes you might realize that they're family that bring you down and they're a little bit toxic. It's okay to not talk to them all the time. And it's okay to find people that are uplifting, that build on you, that you enjoy hanging around with. So just manage your time and see where you're spending most of your time, who you're spending most of your time with. Set good boundaries for yourself and be able to spend time with those people that uplift you, that encourage you, but that bring the best out of you. Self-care is priority, and I love to make it number one and encourage you to make it number one. If you're on my Facebook, if not, go and search for me, Dr. STEM, Be Encouraged. I was in Jamaica last week for 5 days as part of my self-care. And as I was there, and I know we do have some gentlemen on here, but I work mostly with women when I do retreats and getaways. I couldn't help but think that, I need to bring a group of women here in Jamaica and do these things with some women so that they can just go away from everything and spend a good 5-7 days in Jamaica, or even 3 days in Jamaica. So what do you do for self-care? When was the last time that you took me time, just you time, where you did something for yourself to take care of yourself? There are also 5 dimensions of wellness as you are thinking about, your self-care. These are the 5 things that I need you to pay attention to when you take care of yourself: your physical, emotional, social, spiritual, and again, intellectual levels. Because when you do that, that is something that you will begin to enjoy your life in this moment. I don't take it for granted. I don't know about you that I'm here today and I'm alive and I'm healthy. I never take that for granted. So physical exercise, walking 30 minutes a day, 3 times a week is my gift back to God to say, thank you for this life and thank you for this moment, because I'm able to walk, I'm able to exercise. Try it out and just do it. Even if you can walk outside, Find 5-10 minutes on a YouTube channel and just walk on the spot in the house or wherever you are, and just give yourself time to just exercise. Eat healthy. Don't skip any meals. Avoid drinking and drugging. And I know that, every now and then you want a quick drink to just relax yourself. Just watch it to just make sure that you're not drinking stress out. So take care of the stress and then eat to just relax. Drink to just relax and not to suppress any stress. And then I can't emphasize enough to at least get 6 to 8 hours of sleep every night. Emotional, try to maintain a positive attitude even when problems arise. Discover your personal stress relievers. What helps you to relieve stress? I love music. So if you get to all my social media, you also see that I love music. I play music a lot. Find someone that you trust who you can openly share your feelings with. Seek professional help. Smile even when you don't feel like it. Socially, get involved, be present, and be mindful. I know with many of us, we are like, well, with COVID, we can hang out with friends or anything. Make it an effort, even if it's on Zoom, join in those Zoom meetings, call your friends to join you on a Zoom, just like we're doing now. Talk about what's going on in your life, just like you are doing at work, and, keep in touch and stay in touch with your friends. And then spiritually, find a quiet place and spend time there every day. Our minds are going through a lot. So mindfulness is big right now, of just finding quiet time that you can just relax your mind and, empty out everything that is going on. We're going to need to practice mindfulness. It's not something that we grew up knowing, but now it's something that we need to learn to do that. If you go on YouTube, you will find some mindfulness meditations that I recorded, and also, put some there that are professionally recorded as well. You just, Google Dr. STEM mindfulness on YouTube. You'll be able to get some mindfulness practices if you have never done, mindfulness, or you want to get some new ones that will be, very relaxing. As I said, intellectually, find something that can just increase your knowledge on a daily basis, seek academic help, become a lifelong learner. And then this one here, I want to remind all of you to be kind to yourself. Be prepared that some days will be worse than others. There may be windows of improvement followed by more difficult times. This is life. There are ups and downs in life in general. So don't be too hard on yourself when things don't work out, or, life happens, as they say. Make sure to keep in touch, as I said, with family and friends. Don't worry, I'm about to end. Okay, have a daily routine. This will help improve your mood. Stay active and be patient with yourself. I cannot emphasize this enough. Mental health affects us all, and how you deal with it will make a difference not only to your life, but to the life of those that you're taking care of yourself. And pretty much, this nurturing mental health, is, again, just a repetition of what I just talked about, to practice, breathing, exercising, sitting meditations, walking meditations. You might be like, what is a sitting meditation? Don't worry. If you go on YouTube and go onto those meditations, you'll be able to find all that information, because I recorded as sitting meditation. You get a 5-10 minute sitting meditation where I'm guiding you on what to do and how to relax your mind and take care of yourself. Gratitude is big when you're taking care of yourself, and especially maintaining good mental health. Focus on those things that are working well. When you find yourself stressed out and being in a bad position, find the things that are working out and be grateful for that. I always tell people I don't take it for granted that I'm in the United States of America, because many people that I went to school with, that I grew up with, relatives and friends, wanted to come here. They didn't get that opportunity, and they're still trying. Those that are alive still cannot get that opportunity. And every day, that's my number one thing that I'm grateful for. Thank you, God, for bringing me into this country where I've been saved from many ailments and many things that could have, taken my life. if I was still back home. Name at least 3 things that you're grateful for. Write them down. Practice gratitude at the beginning or even at the end of the day. I love what Aristotle said. He says, it is during our darkest moments that we must focus to see the light. I know I'm running out of time, so I'm not going to go through, this whole slide, but I left it in for a second so that when you go through this, PowerPoint, I'm giving, Ms. Buke permission to share it with you. You can see some of the things that we need to continue focusing on to cope with mental health stigma. We have to release it. We have to normalize our mental health. So if you're at work, what are some of the things that you can see that might say, you know what, let me take care of myself. Here's the thing. When you show up at work, I want to remind all of you, because many people say, well, you know what, the people in my job don't even care, that I'm feeling sick. Well, they care. And that's why they pay part of your health insurance or even mental health insurance. But when you show up and you clock in, remember, you're saying, I'm mentally well and I'm ready to work. So they want you to bring your best self forward. So it's up to you to notice that, you know what, I'm decreasing my job efficiency. I'm not doing the work the way that I used to do or the way that I do. If you're being absent, your appearance is not, the same way that it used to be. You're feeling a little bit confused. Your relationships are not working well. You're not sleeping well at home, so you end up sleeping on the job. You just don't feel like talking to anyone. You come in and you don't want to be bothered. People used to, when I was in residential, programs, people used to say, I don't want to be bothered. I'm like, wait. You can't come to work and say, I don't want to be bothered, because then, you're taking care of people and then you're working with people. So if I talk to you, I'm not bothering you, but you feel bothered if your mental health is not taken care of, because then you start having mood swings and then you don't want to talk to people and then you're mad or you're just irritated. Take care of yourself if any of these are, present in your life or someone else. The resources that will help you, as I mentioned, if you have EAP benefits, that's free mental health counseling. If not, just call your health insurance. If you want to look for a therapist, go to www.psychologytoday.com. You'll be able to search for therapists in any area, put your zip code, and you'll get a list of therapists that you can work with. The good thing about right now, you literally can also work with therapists that are out of state because of their, COVID-19. We are working remotely, and therapists are available from out of state with certain insurances. And then ask friends for referrals if you, don't find anyone on Psychology Today. That's also another way of dealing with the stigma and sharing with people and saying, hey, have you ever, seen a therapist? Do you know of anyone? And most likely many people will have someone to recommend to you. I do have free ebooks that will be very helpful to you. If you go to my website, www.drstemi.com, scroll all the way down, it says free books in there, at the bottom. Put your email there and you will get all these 4 books. And I think I added on some more, over there as well. Download them. They'll be helpful. Share with other people. And, let's take care of our mental health. I also have free books, my real books that I've written. Remember I said I have 40 something of those. You will find about 6 of them, I think I put on YouTube. You can listen to the whole book for free. It's Time to Shift from Fear to Faith, Finding Your True Self. This one is my memoir, Thriving Beyond the Tears, The Power of Prayer and Belief. You will find all those books that I went into the studios and read. I think they will be inspiring, motivating, and encouraging to all of you. This is what you will see if you find you search for those mindfulness meditations. You just go in again and just put Dr. Stem mindfulness meditations. You will see these meditations. You see how it's 6 minutes. So it's really not even, a lot of time that you can spend on it. 6 minutes will really help you come to that point where you are calm and rested. Again, I have loved being here with all of you. So to get in touch with me, please email me at drstem14@gmail.com or visit my website at www.drstemi.com. Once again, Thank you so much. And as I always say, be encouraged. Thank you.
Are you ready to live your best life? You deserve to wake up in the morning feeling excited about the day ahead. Don't waste any more time putting off your heart's desires. Embrace your passionate, joyful life with our brand new Unstoppable Renew You Love Your Life 90-day coaching program. Discover what makes your heart sing. Together we'll set meaningful goals and craft a path to a life you absolutely love. Are you ready to be free, fearless, and unstoppable? Visit our website at www.drstemi.com to learn more and book a free discovery call.